most dentists feel like they could do 2 hygiene exams. It's when we get to 3 that, it's the straw that breaks the camel's back.
Last question, Gary. I totally get the value of a hygiene-driven practice, but I struggle with managing the hygiene exams. I currently have 2 hygienists each day, and I have room and the demand to add more hygiene days. But I'm not excited about doing 3 hygiene exams per hour. Any suggestions?
Oh, wow. That one, I think every dentist listening to that question struck a nerve. That question struck. And I want to be tremendously empathetic. I get it, doc. Now, Grant, I'm not a dentist. I've never had to do 3 hygiene exams an hour, but trust me, I get it. You're trying to be a relationship-driven practice. You're providing restorative dentistry, and you're getting to a different patient, and now you have to get up 3 times an hour, and you're thinking, I'm just concerned that the patient on my restorative side, and maybe even you've got another room on restorative, and you're thinking they're going to think, what am I, a second-class citizen? You got to get up. What am I, chopped liver? Yeah, I get it. I have a wonderful client. It's a mutual client of ours. We both know him, Naren. And this client says, if it wasn't for all these darn hygiene exams, I could get some work done around here. And I get it. And we both laugh about that, because if it wasn't for all these darn hygiene exams, he wouldn't have future treatment on his schedule.
Right.
So he gets it. And so I want to get real tactical here. 4 days a week, we have triple hygiene. We have 1 doc with three hygienists. And in the morning huddle, as we're going through our morning huddle, one of the things we identify in the morning huddle is we try to identify 1 patient an hour who doesn't need a hygiene exam. Most dentists feel like they could do 2 hygiene exams. It's when we get to 3 that, it's the straw that breaks the camel's back. So we try to find 1 an hour that doesn't need hygiene. It might be a perio maintenance patient, of course, or it could be a healthy adult with no unscheduled treatment. If it's a healthy adult, but they have unscheduled treatment, then we want to see them because we want to reinforce that unscheduled treatment plan. And generally, we could find 1 an hour. We give up the revenue from the hygiene exam. We don't play any games with, saying we did an exam. No, we have high integrity with everything we do. If we don't do an exam, we don't do it. Now, I will say that I teach my clients to pop their head in the room and say hello. Hey, Naren, it's Dr. Paul. I knew you were here in hygiene today. Kelly tells me everything's looking great. I just wanted to say hello. Good to see you today. That's not an exam. That's a meet and greet.
Right.
And we can do that. And that you generally can be done, and not have the patient in your chair feel like they're getting second treatment. And you can cover it up with a smoke screen. Imagine a doctor saying, Naren, imagine you're my restorative patient. Hey, Naren, we're at a good point to kind of rest your jaw. I want you to close your mouth. I want to pop the chair up so you can get a little more comfortable. We're at a good point. Take a little rest. I'll be right back. So you can kind of smoke screen a little bit. Yeah. The other thing I would say, well, I got one more tip. The other thing I would say is that oral conscious sedation, whenever you could do sedation dentistry, oral conscious sedation is a great tool because with oral conscious sedation, we use it. It's a practice builder. You can get up 3 times an hour to do an exam. The patient doesn't even know you left the room. With oral conscious sedation, they're conscious, but they're in a kind of a foggy state. So they respond to your commands, turn left, turn right, open wider for me. They just don't remember it. And they're in this kind of twilight state. But honest to gosh, you can get up 3 times an hour. And I love oral conscious sedation. Now, you're not going to do that, on every patient, but for our longer appointments, that's a great way to manage this as well. Hey, if you enjoyed this video, make sure to like, subscribe, and leave a comment to us saying I subscribed. Most importantly, be sure to click the bell button, which means you'll be subscribed so you won't miss out on any future videos.